The explosion hit at 6:47 in the morning, and by 6:52, the first ambulance was already screaming toward Harrow Peak Medical Center, with a man whose left leg was essentially gone below the hip. By 7:04, there were 11 vehicles in the bay. By 7:19, the number was 32. Doctors were shouting over each other. A charge nurse was crying in the supply corridor. Equipment was being pulled from storage rooms. Nobody had opened in months. In the middle of all of it, one woman stood completely still at Trauma Bay 3, already gloved, already positioned, watching the doors like she had been waiting for exactly this. Nobody understood why she looked ready for a disaster that had just begun. Before this story goes any further, if you're watching right now, hit that subscribe button and turn on notifications, because every week we bring you stories like this one. Ordinary people hiding extraordinary pasts and the moments that finally force the truth into the light. Drop a like if you're already hooked, and tell me in the comments, what city or country are you watching from? I want to see how far this story travels. Now, let's get into it. The Harrow Peak Medical Center sat at the eastern edge of Crestfall, Colorado, pressed against the foothills like it had been pushed there by the mountain itself. It was not a glamorous facility. The trauma bay had 12 beds and a leaking ceiling tile in the far corner that maintenance had been promising to fix since October. The vending machine near the nurse's station dispensed coffee that tasted like warm cardboard. The parking lot flooded every spring without fail. It was also the only Level 2 trauma center within 60 miles, which meant that when the Caldwell Industrial Chemical Processing Plant detonated its eastern storage unit at 6:47 on a Tuesday morning, Harrow Peak was where every single survivor was headed. Mara Delgado arrived for her shift at 6:30, which meant she was already inside when the first call came over the radio at 6:54. She was changing out of her street shoes in the locker room when the overhead alert sounded 3 short tones, then a dispatcher's voice that was trying very hard to stay professional. Mass casualty incident. Caldwell Industrial Facility. Approximate victim count, 40 to 60. Burn injuries, blast trauma, crush injuries. First units, ETA 7 minutes. Marfa tied her second shoe and stood up. She was 31 years old, average height, with dark hair she kept in a tight braid, and a face that people routinely described as calm in a way that was not always meant as a compliment. She had worked at Harrow Peak for 11 months. She'd been hired without fanfare, assigned to the general trauma floor without ceremony, and had spent nearly a year doing her job that attracted very little attention from the people who had handed out around here. That was fine with her. She walked to her locker, retrieved a second pair of nitrile gloves, pocketed them, and headed for the trauma bay. By the time she pushed through the double doors, the bay was already transitioning from its normal low-grade morning chaos into something sharper and louder. Nursing staff were pulling supply carts. 2 residents were power walking toward the far end with the slightly panicked energy of people who had trained for this moment and were now realizing training was not the same as the real thing. Dr. Preston Hartwell was already holding court near the central station. He was the trauma chief at Harrow Peak 44, square-jawed and possessed of the particular confidence that grows in men who have been the smartest person in most rooms they've walked into. He was not an incompetent physician. He was, however, the kind of doctor who had stopped listening to nurses somewhere around year 8 of his career, which was a problem that hadn't caught up to him yet in any official capacity. He was giving instructions in a voice calibrated to project authority rather than information, and the residents were nodding in a way that suggested they were absorbing approximately 40% of what he was saying. Mara moved to Trauma Bay 3, checked the crash cart, confirmed the airway kit was stocked and positioned correctly, and then stood back and waited. Charge nurse Dolores Kwan found her there 30 seconds later. Dolores was 52 and had the energy of a woman who had been managing crises since before some of her staff were born. She was not cruel, exactly. She had simply developed a rigid set of categories over the decades nurses who could be trusted with complex cases and nurses who needed supervision, and Mara had never made it out of the second category in Dolores's mental filing system. Delgado. Dolores said her name like a mild reprimand. I need you running supply rotation on the south end. Dr. Hartwell wants experienced staff on the primary bays. Mara looked at her steadily. I'm assigned to Bay 3. I'm reassigning you. Is there a specific clinical reason? Or I don't have time to explain administrative decisions to floor staff right now. Dolores was already turning away. South end. Keep the cart stocked. Mara didn't move immediately. She looked at the trauma bay, at the equipment she had just verified, at the positioning she had already calculated, at the sight lines to the entrance doors. Then she looked at the clock on the wall. The first ambulances were 90 seconds out, according to the radio chatter she'd heard on her way in. She went to the south end. She stocked carts for 4 minutes. She kept her eyes on the bay. The first ambulance hit the doors at 7. 4 hours exactly, and within 10 minutes, the trauma floor had transformed into something that occupied the space between controlled and catastrophic without quite falling into either. The injuries were severe and varied chemical burns from the accelerant release, blast wave concussions, 2 crush injuries from structural collapse, and several workers who had been close enough to the initial detonation to absorb fragments of the storage unit's exterior casing. Hartwell moved between cases with the practiced efficiency of a trauma chief who knew how to triage and direct. He was not paralyzed. He was, in the genuine clinical sense, a functional physician under pressure. But he was missing things. Mara saw the first one 14 minutes into the response. A worker named according to his ID badge, which was still clipped to his jacket tee. Burkhart was on a gurney in Bay 6, being assessed by a second-year resident named Dr. Solis. Burkhart was conscious and vocal, which was creating the impression that he was more stable than he appeared. He was complaining about his arm, which had a significant laceration, and the resident was focused on that arm, with the tunnel vision of someone whose attention had been successfully captured by the most obvious injury. Mara was 6 feet away, pulling a supply cart, and she saw Burkhart's neck, the distension in the jugular vein, the slightly labored quality of his breathing that didn't match his vocal volume. The way he kept adjusting his position on the gurney, small, unconscious shifts that looked like restlessness, but were actually the body trying to compensate for something. She stepped closer. Dr. Solis. The resident didn't look up. I'm in the middle of an assessment. I know. I think he has a developing pneumothorax. That got Solis's attention. He looked at her with the particular expression that young residents deploy when they are uncertain whether to be annoyed or alarmed. He's talking fine. Breath sounds on the right side. She said it simply, not as a challenge. Solis hesitated for exactly 2 seconds, then reached for his stethoscope and listened to the right side of Burkhart's chest. His expression changed. He called for Hartwell. Hartwell arrived in 40 seconds, listened himself, and ordered the decompression. Burkhart was stabilized within 8 minutes. The doctor who received credit for the catch was Solis, who did not correct the record. Mara went back to the supply cart. She documented the observation on the intake form she wasn't technically supposed to be completing from her current position, noted the time, and moved on. That was how the morning went. She caught a medication calculation error at Bay 4. For a burn patient's morphine dose had been written at 10 times the appropriate concentration. A transcription mistake that happened when the resident tried to read a form over someone else's shoulder and copied the wrong number. Mara flagged it quietly to the pharmacist, who corrected it before it reached the patient. She noticed a patient in Bay 9 who was showing the early signs of compartment syndrome in his forearm subtle. Easy to miss in the chaos, but visible if you were looking at the patient rather than the chart. She brought that one to Dolores directly, because the resident assigned to Bay 9 was already occupied, with a more acute case. Dolores took the information with the practiced neutrality of someone who is deciding in real time whether to be grateful or resentful. She passed it to the attending on the floor without attribution, and the patient got the intervention he needed. Mara wrote it down: time, patient location, observation, outcome. She'd been keeping that record for 11 months in a small notebook she carried in her left scrub pocket. Nobody knew she kept it. By 9:30, the immediate mass casualty response had shifted from acute chaos into the grinding work of stabilization and triage management. The most critical patients had been addressed. 2 had been transferred to the level facility C in Denver. One had not survived the initial resuscitation, a man with injuries too catastrophic to reverse, regardless of what anyone did or didn't do. The trauma floor was exhausted and still functional, which was about the best you could say for a Tuesday morning. That had started with a chemical plant explosion. Mara was completing documentation at the nurse's station when Hartwell stopped beside her. She had spoken to him exactly twice in 11 months. Both times had been brief, professionally appropriate, and essentially invisible to him. She was aware that he knew her name only because it appeared on schedules he reviewed. He looked at her now with the particular expression of a senior physician who has just noticed a piece of furniture he's been walking past for a year. "You're Delgado?" "Yes." "Dolores tells me you were supposed to be on supply rotation." "I was." "She also tells me you were inserting yourself into clinical assessments." He said it in a tone that wasn't quite accusatory, but was leaning in that direction. "I made 2 observations that were passed to attending physicians. Both were confirmed and addressed." She kept her voice level. "I documented both. Nurses document nursing care. They don't redirect attending assessments." She looked at him for a moment. "Patient in Bay 6 had a right side pneumothorax. That was missed on initial assessment. Patient in Bay 9 had early compartment syndrome indicators. Both were caught, both were treated, both patients benefited. If the method of communication was a problem, I'm happy to discuss appropriate channels." But the observations were accurate. Hartwell's jaw tightened slightly. He was not used to being answered in complete organized sentences by floor nurses, and it showed in his face. Smacked him. "Stay in your lane, Delgado. I'm here to keep patients alive," she said. Not aggressive, not emotional, just a fact. He left. Dolores, who had been within earshot, materialized at Mara's elbow, approximately 10 seconds later. "That was not smart." "Probably not. He doesn't forget things like that." "I know." Dolores studied her for a moment with the particular expression of a woman who is trying to work out whether she's looking at arrogance or something else. She didn't seem to arrive at a conclusion. She left without saying anything further. Mara finished her documentation and went back to work. The second wave hit at 11:15. Not another external disaster, this was the internal wave. The one that always came a few hours into a mass casualty response when patients who had initially appeared stable began to deteriorate. The adrenaline was wearing off. The body's compensatory mechanisms were exhausting themselves. Things that had been hidden by shock were starting to surface. Bay 7 held a man named Felix Oron, a plant worker who had been brought in with blast concussion and a laceration to the shoulder. He had been conscious, oriented, and relatively stable at admission. He was now showing something different. Mara picked it up from across the floor, the change in his color, the way his breathing had shifted rhythm, the subtle restlessness that was different from his earlier presentation. She moved to his bay and checked his vitals without being asked. His blood pressure had dropped 15 points from the last recorded reading. His pulse was elevated and thready. She pulled back the blanket. The abdominal rigidity was unmistakable. He had an internal injury that had not been caught on initial assessment, likely a splenic laceration, given the mechanism and the presentation. But the exact source was less important in this moment than the fact that he was bleeding internally and his pressure was headed in one direction. Mara went straight to the overhead intercom at the nursing station and called Hartwell by name. He arrived in 90 seconds, which was fast. To his credit, he assessed Oron quickly and correctly. He called surgery within 2 minutes. Oron was in the OR within 12. He would survive. The surgeon's post-op report would later note that the intervention window had been very tight, another 30 to 40 minutes of delay, and the outcome would likely have been different. Hartwell did not acknowledge Mara's role. She was already back at the nursing station by the time he finished redirecting the floor staff. She wrote it down. At 2:00 p.m., a general shift change was underway, and the incoming staff were being briefed on the day's remaining patients. Mara was in the middle of her handoff report when Dolores appeared in the doorway of the conference room and asked her to step out. The conversation was short. "Dr. Hartwell has filed a formal concern," Dolores said. They were in the hallway, just outside the conference room door. And Dolores was speaking in the tone of voice she reserved for unpleasant administrative transactions. Repeated unsolicited clinical interference, undermining attending authority during a mass casualty event. Mara stood still. That's what he called it. That's what he filed. Every observation I made was documented. Every one was confirmed by an attending physician and resulted in a changed treatment plan. I'm aware. Dolores's expression was difficult to read, not hostile, exactly, but it's not sympathetic either. That's noted in my response. But when a trauma chief files a formal concern, it goes to administration regardless of the context. What does that mean for my schedule? Dolores hesitated for exactly 1 second too long. You're on administrative hold while the concern is reviewed. No patient-facing assignments until the review is complete. Mara absorbed this. How long is the review? Typically 5 to 10 business days. She nodded once. Okay, Mara. Dolores said her name differently slightly, almost imperceptibly, and Mara paused. The observations you made today were clinically sound. I'm not disputing that, but the way you made them created a problem that is now my problem. And I need you to understand that context when you respond to the review panel. Mara looked at her for a long moment. I understand the context, she said. I've understood it for 11 months. She collected her belongings from the locker room and left the building. In her car, before she started the engine, she opened the notebook and added the day's final entries: times, observations, patient identifiers, outcomes. Then she added a new entry at the bottom. Formal concern filed by Dr. Hartwell. Administrative hold pending review. Then she put the notebook in her bag, started the car, and drove home. 3 days passed. They were quiet days, externally. Mara ran in the mornings, made food she actually paid attention to cooking, and slept more than she normally did. She did not catastrophize. She did not spend those days drafting complaints or making phone calls or planning her defense in the way that most people in her position would have been tempted to do. She organized her documentation. 11 months of it. Dated, time-stamped, cross-referenced by patient location and attending physician. Medication calculations she had flagged, and the corrected versions that followed. Observations that had been initially dismissed and later confirmed. A pattern that was very clear once it was laid out in sequence, though it had been easy to ignore one instance at a time. She also pulled 3 specific incident reports from the hospital's internal system reports she had access to as a staff member. Nothing she wasn't entitled to see involving patients under Hartwell's primary care over the past year. 2 had been resolved without complication. 1 was still listed as under review by the quality committee. That one had a filing date of 7 months ago. She noted it. She did not yet understand its full significance. She would, later. On the 4th day, she received a formal letter from hospital administration. Her hearing before the disciplinary review panel was scheduled for the following Monday at 9:00 a.m. She was invited to bring documentation supporting her account. Dr. Hartwell would present the complaint. She confirmed her attendance by email using 3 sentences. On Sunday evening, she laid out her documentation in the order she intended to present it, made a single copy of everything, sealed it in an envelope, and put it in her bag. Then she went to sleep at a reasonable hour. Monday morning arrived the way Monday mornings did in Crestfall, in late autumn, gray and cold and honest about it. Mara drove to the hospital, found parking without difficulty, and was in the administration building's second-floor conference room by 8:47. The panel was already assembling. 3 people, the hospital's patient safety officer, a physician from the credentials committee who was not affiliated with the trauma department, and a human resources representative who was there to ensure the procedural correctness of whatever happened next. Hartwell arrived at 8:55 with Dolores beside him. He was in his white coat, which he almost never wore in clinical settings, but which apparently served a different function in administrative ones. He didn't look at Mara when he sat down. This was itself a form of communication. Mara sat across the table with her hands folded on the envelope. The panel led the patient safety officer, a woman named Dr. Anita Sorensen, began the proceedings with the procedural summary. The concern filed by Dr. Hartwell, the scope of the review, the ground rules for the discussion. Then she asked Hartwell to present his account. He spoke for 11 minutes. He was composed, articulate, and very good at framing 11 months of patient safety observations as a pattern of reckless insubordination. He used phrases like clinical overreach and disregard for established hierarchy and an inability to function within appropriate nursing scope. He mentioned the mass casualty day 3 times. He described Mara's interventions as chaotic rather than effective, as creating confusion rather than resolving it. He was a doctor who had been giving presentations his entire career, and it showed. When he finished, Sorensen turned to Mara. "Ms. Delgado, your response?" Mara opened the envelope. She began with the dates. Not arguments, not emotional framing, just the dates. The patient, locations, the specific observations, and the documented outcomes. She went through 11 months of it in a voice that did not change pitch or speed regardless of what she was describing. She cited the incident reports by file number. She noted the quality committee review that was still open. She spoke for 14 minutes. When she finished, the room was quiet for a moment. Then the credentials committee physician, a cardiologist named Dr. Huang, leaned forward. "Ms. Delgado, the medication incident on the mass casualty day. Bay 4. Are you saying the dose error would have reached the patient if you hadn't flagged it?" The pharmacist's time-stamped record shows the correction was made 2 minutes before administration was scheduled. Yes. And the patient in Bay 9 with compartment syndrome indicators. What was the delay in intervention after you flagged it? Approximately 8 minutes from my report to Dolores to the attending's assessment. The eventual intervention was within acceptable time parameters. Huang looked at Hartwell. "Were you aware of either of these incidents at the time?" Hartwell's expression remained controlled, but his answer came a half-second slower than his previous responses. The mass casualty day involved significant informational volume. It's not possible to have direct awareness of every... I'm asking if you were informed by any member of your team of either of these specific incidents. A pause. The pneumothorax in Bay 6 was brought to my attention by the resident. By Dr. Solis? Yes. And the Bay 4 medication error? Another pause. Shorter this time, but present. I was not directly informed of that specific incident. Sorensen made a note. The room had shifted in some way that wasn't dramatic or obvious, but was real nonetheless. Then the far door opened. Everyone at the table turned. It wasn't a scheduled interruption. The hospital's operations coordinator, a man named Gareth, who had the permanently worried expression of someone managing 14 problems, simultaneously was standing in the doorway, holding a radio. "I'm sorry to interrupt," he said. "We have inbound. Air transport, military emergency." He looked at Sorensen. "The Bay is going to need every available trauma-trained staff member. Administration is recommending. We pause non-essential. How many? Mara said. Gareth looked at her. One critical. Penetrating chest trauma. ETA 4 minutes. Hartwell was already standing. He looked at Sorensen. We can reschedule. Sorensen was already nodding. We'll reconvene this afternoon. The room began to clear. Mara stood, put the envelope in her bag, and followed Hartwell into the corridor. She was, technically speaking, still on administrative hold. She had no assigned role. She was not, in any official capacity, supposed to be in a clinical area. She went to the trauma bay anyway. She told herself it was simply because she was already in the building. But when she heard the sound of the helicopter, settling onto the rooftop pad, heavy, purposeful, the particular sound of military rotors that was slightly different from civilian air transport, something in her chest, did a thing it hadn't done in a very long time. She pulled on gloves before the doors even opened. And when the gurney came through, when she saw the uniform, the tactical equipment still partially attached, the oxygen mask, and the specific quality of the attending medic's expression, which was not panic, but was the face of someone who has done everything available and is now asking someone else to do more. Mara Delgado moved forward without waiting to be invited. She saw the patient's chest. She saw the neck veins. She saw the trachea. And something that had been very quiet inside her for 11 months went completely still, in the way that things go still right before they move. The patient's name, according to the medic who had come in with the gurney, was Specialist Dana Voss, and she was 26 years old, and she was dying in the specific, accelerating way that penetrating chest trauma produces when the air that shouldn't be there keeps accumulating and the lung that should be working starts losing the battle against physics. The medic, young, male, still in full kit, with dust on his boots that hadn't come from anywhere near. Colorado was giving his report to Hartwell in the clipped, sequential cadence of someone trained to communicate under pressure. GSW, left anterior chest, approximately 4th intercostal space. Initial field dressing, applied at 0940. 2 large bore IVs, 1 liter saline administered en route. SAT was 91, on supplemental O2 when we loaded. It's been dropping. What's it now? Hartwell asked, pulling on gloves. The monitor answered before anyone could, 84%. Mara was already at the head of the gurney, and she wasn't looking at the monitor. She was looking at Dana Voss's neck. She was looking at the way the trachea sat in the soft tissue of the throat, not centered the way it should be, but shifted, barely, the kind of shift that was easy to dismiss as positional artifact if you weren't specifically looking for it. She was looking at the jugular veins, which were distended in a way that didn't match a simple hemorrhage picture. If Voss were simply bleeding out, those veins would be flat. They were not flat. She placed her hand on the left side of Voss's chest, then the right. She didn't have a stethoscope in that moment. Hartwell had one and was using it, pressing it to Voss's chest with the focused expression of a physician running through his differential. Mara didn't need the stethoscope. She had done need the stethoscope enough times in conditions where stethoscopes were not available that her hands had learned to interpret what they were feeling. The left side moved. The right side moved less. Not dramatically less, the kind of less that a busy trauma bay in the middle of a crisis could easily generate a dozen explanations for. But there was only one explanation that fit all 3 findings together. Tension pneumothorax, she said. Right side. Hartwell didn't look up from the stethoscope. She was shot on the left. Tension doesn't always develop ipsilateral to the injury. The mediastinal shift is starting trachea's deviating left. JVD is present. Right side breath sounds are significantly reduced. I'm assessing the patient, Ms. Delgado. She absorbed that. She watched the monitor. The saturation ticked from 84 to 82. The medic, who was standing just inside the trauma bay doors, was watching Mara with an expression she didn't have time to analyze. Dr. Hartwell, she said, and something in her voice changed, not louder, not sharper, but different in a way that several people in the room registered without being able to name it. She is decompensating. If this is a tension pneumo, and we wait for imaging confirmation, we will lose her. Hartwell pulled the stethoscope from his ears. His jaw was set in the particular way of a man who is deciding between two things simultaneously: the correct clinical decision and the decision that preserves a power structure he has just spent the last 40 minutes in a disciplinary hearing defending. The monitor read 80%. For 3 seconds, Mara counted them, because counting was a thing she did in moments like this to keep herself anchored. Hartwell stood there without moving. 3 seconds in a tension pneumothorax was not a long time, objectively speaking. In the specific math of this patient, in this moment, with this trajectory, it was long enough. Mara reached across the supply cart, picked up the 14-gauge needle, was sitting in the tray exactly where she had confirmed it would be before any of this began, and looked at Hartwell directly. "You can tell me to stop," she said, "or you can watch me keep her alive. But I need your answer in the next 10 seconds. Something moved across Hartwell's face that she had not seen there before. It was not deference, it was not respect. It was the particular expression of a physician who has run out of road. He stepped back. 1 step, barely perceptible. Mara moved. She located the second intercostal space at the mid-clavicular line on the right side by touch, angled the needle correctly, and advanced it through the chest wall with the kind of controlled pressure that came from having done this in conditions that made a sterile trauma bay look like a controlled laboratory. The moment the needle entered the pleural space, there was a hiss of air, audible, unmistakable, the sound of pressure finding its exit. The monitor 80%, 81%, 83%. "Get me a chest tube tray," she said. Nobody moved for exactly 1 second. Then the trauma nurse nearest the supply wall, a man named Obi, who had been at Harrow Peak for 6 years and had seen a lot of things turned, and got the tray. Mara performed the thoracostomy with the same quality of movement she'd brought to the needle decompression. Not fast for the sake of appearance, not slow from hesitation, but precise in the way that precision actually looks in practice, which is less elegant than televisions, suggests, and more functional than most people expect. She made the incision, blunt dissected through the chest wall, placed her finger to confirm the pleural space, and guided the tube into position. The monitor, 87%, 89%, 91%. Dana Voss took a breath that was audibly different from the ones before it. The medic at the door made a sound that wasn't a word. Hartwell had not moved from his position 3 feet back. He was watching the monitor with an expression that was unreadable in a way that suggested it was covering something very readable. Mara secured the tube, checked the water seal drainage, and did a final check of Voss's neck trachea recentering, JVD resolving. She stepped back and pulled off the outer glove layer. "She needs imaging to rule out hemothorax and assess for additional injuries," she said to the room. Not to Hartwell, specifically. Chest X-ray first, then CT if she stays stable enough to transport. The trauma team that had been standing in various states of arrested motion began to move again. Obi was already on the phone with radiology. A second nurse was adjusting the oxygen delivery. The resident, who had arrived 2 minutes into the procedure and positioned himself in the writing something on in the doorway, was writing something on a notepad with the diligent energy of someone who has correctly identified that this is a moment worth documenting. The medic crossed the room. He was older than she'd initially assessed, late 30s, with the specific kind of weathering that came from extended field rotations rather than age. His name tape read Carver. He stopped in front of Mara and looked at her for a moment that stretched past professional courtesy. "That was a needle decompression and tube thoracostomy in under 4 minutes on a crashing patient," he said. "Where did you train?" She met his eyes. "Here," she said, which was true in the technical sense and misleading in every other way, and she knew it and said it anyway. "I need to document this procedure." She moved to the charting station. Carver watched her go. The next 2 hours were the kind of controlled aftermath that followed acute resuscitation events. Dana Voss was stable enough for imaging. The chest CT showed the tube in correct position and no significant hemothorax, and she was transferred to the ICU for monitoring and definitive surgical assessment. The military transport team remained in a waiting area down the corridor, which was mildly unusual, but not unprecedented, when a patient was active duty personnel. Mara completed her documentation at the nursing station. She was thorough. She included the timeline from initial patient arrival to needle decompression to tube placement, the clinical indicators she had observed, and the sequence of events. She included Hartwell's name in the appropriate section, the attending of record, because that was accurate, regardless of everything else. She was aware that she was still on administrative hold. She was aware that what she had just done was either going to resolve that situation or dramatically complicate it. She found that she was not particularly distressed about either outcome, which was itself a kind of information about where she was. Dolores appeared at the nursing station at 1:15. She stood beside Mara for a moment without speaking, which was not Dolores's natural mode. "The review panel is reconvening at 3, she finally said. "I know. Hartwell will be there. I know that too." Dolores lowered her voice slightly. "What you did in that bay is documented," Mara said, completely and accurately. Dolores looked at her with the expression she'd worn the other day, the one that was trying to categorize her and kept failing. "He's going to argue you acted outside your scope again. The intervention you performed is within the scope of practice for a registered nurse in emergency situations where the attending is present and the patient is in immediate life-threatening distress." She had looked this up, not in anticipation of today specifically, but because she looked things like this up. "I've already pulled the relevant sections of the Colorado Nurse Practice Act." A pause. "Of course you have. Page 9, Section 4, subsection B." Mara saved her documentation and closed the chart. "I'll be at the 3 o'clock review." She stood and walked down the corridor toward the break room because she hadn't eaten since 7:00 a.m., and her body was beginning to register that fact with some insistence. She was halfway there when she heard her name. Not her last name. Not Delgado in the administrative tone, or Ms. Delgado in the disciplinary one. Mara. She turned. The man standing in the corridor was in his mid-40s in military utility uniform, with the bearing of someone who had been at the high-consequence end of organized operations for a very long time. He had a full-bird colonel's insignia on his collar. He was looking at her with an expression that was not recognition. In the casual sense, it was the specific recognition of someone who knows a face from a context that carries weight. She studied him for 3 seconds. Colonel James Warwick. She had last seen him in a forward operating base in Kunar Province, in a context that was classified in ways she was not going to think about in a hospital corridor. She had treated one of his men. She had kept one of his men. She had kept one of his men alive in a situation where the math had not favored it. That had been 8 years ago. "Colonel," she said. He walked toward her, and when he was close enough that the conversation was private, he said, "I heard what just happened in that trauma bay." It was a clinical intervention on a critical patient. Carver gave me a full account. He studied her. He said it was the best field decompression he'd seen since. He stopped. Since the last person he saw do it, who didn't work in a field hospital. She didn't say anything. "What are you doing here, Chief?" The word landed differently than she'd expected. She had been Mara Delgado for 11 months, and before that, she had been a dozen other things in a dozen other places, and the word chief belonged to a version of herself she had deliberately set down. She had set it down because she wanted to work without its weight attached, without the institutional shortcuts it provided, without knowing whether the people who trusted her clinical judgment were trusting her or trusting the record that preceded her. She had wanted to know if she was good enough without the title. "I'm working," she said, "in a civilian ER on administrative suspension." She didn't ask how he knew that. He was a colonel with military personnel in this facility, and presumably had the conversational capacity to gather information from administrative staff. Yes, because of the physician who just stepped back while you saved his patient's life. That's a complicated characterization of what Mara, he said it quietly, but with the certainty of someone who did not deal in euphemism. I'm going to your 3 o'clock review. She looked at him. I know it's not protocol. I also know what I watched Carver describe in that waiting room, and I know what your record looks like. And I know that Specialist Voss is in the ICU breathing consistently because of what you did 20 minutes ago. So I'm going to sit in that room, and if they'll let me speak, I will. And if they won't let me speak, I'll stand there until the end, and then I'll request a meeting with whoever makes the final decision. She was quiet for a moment. I don't need someone to rescue me. I know you don't. He held her gaze. I'm not rescuing you. I'm bearing witness. There's a difference. She considered that for a moment that was longer than it probably appeared from the outside. The review is at 3, she said. Room 214, Administration Building. She turned and continued toward the break room. The 3 o'clock reconvening of the disciplinary review panel it had a different texture than the morning session, and everyone in the room seemed aware of it without anyone naming it directly. Dr. Sorensen was in her same seat, the cardiologist doctor. Huang had returned. The HR representative, whose name Mara had noted as Greta Mullins, was positioned at the end of the table with a legal pad and the particular alertness of someone who antiphysisted that this afternoon would generate paperwork. Hartwell sat in the same chair as the morning. His body language was the same, composed, slightly forward-leaning, the posture of a senior physician who expected to control the room's attention. But something in his face was different. A quality of set, like a person who has been arguing with himself for 2 hours and hasn't resolved it. Colonel Warwick sat in a chair along the wall, outside the formal panel configuration, in the specific way of someone who understands institutional space and has positioned himself within it very deliberately. He had been introduced by Sorensen at the start of the session as a representative of the military transport team whose patient had been treated. He had not been invited to speak. He had been acknowledged and seated. He folded his hands in his lap and looked at the table. Mara sat across from the panel with her envelope. Sorensen opened the afternoon session by noting that an emergency clinical event had occurred during the recess involving a military personnel patient in acute distress, and that Ms. Delgado had been present in the trauma bay during that event. She asked Hartwell to describe the incident from his perspective as the attending of record. Hartwell spoke for 6 minutes. He described the arrival of the patient, the assessment sequence, and the intervention. He described Mara's actions as unauthorized initiation of an invasive procedure and as consistent with the pattern of unsanctioned clinical overreach that had prompted the original complaint. He used the phrase scope violation twice. He noted that the patient had stabilized, but framed that outcome carefully. The stabilization was the result of the full clinical team's response, not any single action. Huang interrupted him. Dr. Hartwell, at the moment Miss Delgado performed the needle decompression, what was your action? A pause. I was assessing the patient. What had your assessment concluded at that point? Another pause. Shorter but present. I was in the process of ruling out certain diagnoses. The oxygen saturation was 80%. The patient was deteriorating in real time. What was your plan at that moment specifically, in the 30 seconds before Ms. Delgado initiated the decompression? Hartwell's jaw tightened. I was going to order imaging to confirm the diagnosis before proceeding with an invasive intervention. You were going to order imaging, Huang said, with an oxygen saturation of 80% and a clinical picture consistent with tension pneumothorax, consistent with several possible diagnoses. How many of those diagnoses would have been harmed by an empirical needle decompression if the tension pneumodiagnosis proved correct? Hartwell looked at Huang with the expression of a man who has just realized. He is in a conversation. He cannot win through the method. He normally wins conversations. In medicine, we don't make invasive decisions based on minutes. The tension pneumothorax was confirmed by the response to the decompression, Huang said, and by the subsequent imaging. Ms. Delgado's diagnosis was accurate. Her intervention was timely. The patient survived and is currently stable in the ICU. He looked down at the notes in front of him. Is that a fair summary of the outcome? Hartwell said, yes, in a voice that technically the same volume as his previous answers, but somehow occupied less space. Sorensen turned to Mara. Ms. Delgado, can you walk us through your clinical reasoning for initiating the intervention? Mara walked them through it. She was precise and unhurried. She described each clinical sign, the sequence in which she observed them, the differential she ran, and the decision point at which the weight of evidence became sufficient to act. She did not dramatize it. She did not editorialize. She delivered it the way she would have delivered a clinical handover report. All the relevant information in the correct order. When she finished, Greta Mullins, who had been writing steadily since the beginning, looked up and said, Miss Delgado, you mentioned being aware that you were on administrative hold at the time of the intervention. Can you speak to that? I was in the administration building for the morning session of this review, Mara said. When the mass casualty alert for the inbound patient was called, I went to the trauma bay. I am a trained trauma nurse. The patient was in life-threatening distress. I made a judgment call that the situation warranted my presence, regardless of my administrative status. And you accept that there may be institutional consequences for that decision. I accept that the decision was mine and that I'm accountable for it. She paused for one beat. I also accept that Specialist Voss is breathing. Mullins wrote something down. Then Colonel Warwick spoke. He didn't stand. He spoke from his chair along the wall, in a voice that was level and unhurried, and quietly capable of filling a room without effort. With the panel's permission, Sorensen looked at him. Colonel, I'm not here to influence a personnel decision, he said. I want to make that clear. What I can offer is direct information about the individual you're reviewing, because I have knowledge of her record that doesn't appear to be part of this proceeding. Hartwell looked at Warwick. Her record as a floor nurse has been thoroughly. Her record as Chief Petty Officer, Mara Delgado, United States Navy, Medical Service Corps. 3 combat deployments, 2 with Special Operations Medical Support Teams. Warwick's voice did not change cadence or volume. She was the senior trauma specialist on a Tier 2 surgical support element, operating in environments where the nearest conventional medical facility was sometimes a 4-hour helicopter flight. She performed interventions in those environments, including emergency thoracostomies under active threat conditions, without anesthesia support and without the option of calling for a second opinion. The room was very quiet. She was awarded the Navy and Marine Corps Commendation Medal for actions during the Kunar Province operation in 2016. She was recommended for the Bronze Star by 2 separate commanders. She left service honorably and of her own choosing. He let that sit for a moment. I came to this hospital today because one of my soldiers needed emergency air transport. The reason that soldier is still alive is that Mara Delgado was in the building. Hartwell was looking at Mara. She was looking at the table. She had not told them any of this because she had never told anyone any of this. Not since she'd walked through Harrow Peak's employment entrance 11 months ago, with a resume that listed her nursing credentials and her civilian work history, and nothing else. She had made a deliberate decision to be assessed on the work she was doing now, in this facility, in this role. She had made that decision, and she had lived it for 11 months, and she had documented every single instance where her judgment had proven correct, because she had known with the calm, data-grounded certainty of someone who has operated in high-consequence environments for a long time, that the documentation would eventually matter. Hartwell was still looking at her. She met his eyes. and in his expression, behind the composure and the clinical authority and the practiced professionalism, she saw the specific moment when someone realizes that the story they have been telling about another person and about themselves in relation to that person is not the story that the evidence supports. It was not a satisfying moment. It didn't feel the way she might have imagined it would feel in some hypothetical version of this situation. It just felt like the truth arriving at the pace truths arrived, which was usually slower than it should be and quieter than people expected. Sorensen looked at Hartwell. Dr. Hartwell, in light of this information, do you wish to revise your characterization of Ms. Delgado's conduct? Hartwell was quiet for 4 seconds. I would want to review her full service record before making any revised statement. That's your right, Sorensen said. She turned to the full panel. We'll take a brief recess and reconvene. I'd like Greta to contact the Credentials Committee about an expedited record review. And I'd like Dr. Hartwell and Ms. Delgado to both remain available. Chairs moved. People stood. Mara picked up her envelope and stood. Warwick caught her eye from his position along the wall, and she gave him a single nod that carried more than it appeared to. She was almost to the door when Dolores stepped in front of her. Not aggressively, more the way someone steps in front of you when they have something they need to say before the moment passes. I should have pushed back on the complaint when it was filed, Dolores said. Her voice was low. It did not sound like a woman making a strategic calculation. It sounded like a woman who had been sitting with the thing for several hours and had to say it out loud. I knew your observations were sound. I knew the medication error catch was legitimate. I told myself the administrative situation was. She stopped. It wasn't right. Mara looked at her for a moment. Okay, she said. That's all you're going to say? I appreciate you saying it. She meant it. It wasn't the entirety of what she felt, but it was the true part, and the true part was what she offered. She walked out into the corridor. She found a chair near the water fountain and sat in it and put the envelope in her lap and looked at the wall in front of her, which was institutional beige and had a small scuff mark near the baseboard that someone had made and no one had cleaned. She was not celebrating. She was not cycling through what had just happened with the emotional accounting that most people would have been doing. She was doing a thing she had learned to do over years of operating in environments where the outcomes were not fully in her hands. She was waiting, and she was staying present. And she was not spending any energy on the next 3 hours that was better kept in reserve. Because she was not finished here. She knew it, the way she knew clinical signs not from a single data point, but from the pattern. Hartwell was quiet in a room where he should have been defensive, and the state of a man going quiet when he should be defending himself was a state that meant something. And the quality committee review that had been sitting open for 7 months, the file she had noticed in the hospital's internal records without yet understanding its full significance, connected significance to something. She didn't know what yet, but the documentation was still in her envelope, and Hartwell was still in room 214, and Specialist Voss was breathing in the ICU, and Colonel Warwick was bearing witness. She sat in the chair by the water fountain and waited. Then her phone buzzed. The text was from a number she didn't recognize, but the message was 4 words that she read twice before she understood what they meant. And when she understood them, her hand became very still on the phone in her lap. They found the Orana file. She read the message a 3rd time. Not because the words were unclear, they were 4 words, and they were very clear, but because the name in them was one she had encountered in a file 7 months old, buried in the hospital's quality management system, listed under a case number she had found by accident and noted without context. Orana. She did not know who had sent the message. The number was not in her contacts and carried no area code she recognized. She did not know what found meant in this context, found as in located, found as in opened, found as in handed to the people who could use it. She did not know who they was. What she knew was that her hand was steady on the phone, and her pulse was not elevated, and the beige wall in front of her was still beige and still had the scuff mark, and that this was a piece of information that changed the shape of what was happening in room 214. She put the phone in her pocket and sat for 11 more seconds. Then she stood up, walked to the end of the corridor, turned left into the administrative wing, and knocked on the door of the patient safety officer's office. Dr. Anita Sorensen opened it herself. She had the look of someone mid-task, reading glasses pushed up into her hair. Ms. Delgado, the recess isn't— I need to tell you something before the panel reconvenes, Marcia said. It's about the quality committee file that's been open since March. Case number QC 317, a patient named Orana. Sorensen looked at her for a moment. Then she opened the door wider. The office was small and stacked with binders. Sorensen sat behind her desk, and Mara sat in the single chair across from it and spoke for 7 minutes without interruption. She described the quality committee file she had found in the hospital's internal records system. She described what it contained, insofar as she had been able to read it with her staff-level access: a patient admitted in March under Hartwell's care, a post-operative complication, a mortality outcome, and a notation that the case had been flagged for review by an attending nurse who had documented concerns about the preoperative medication protocol. She described the flagged concern, which she had read once, and retained in the way she retained clinical information, not photographically, but structurally, the shape of it, the sequence. The flagged nurse had noted that the patient had been given a medication combination that carried a documented interaction risk. The flag had been filed. The attending had not been notified through the formal channel. The patient had deteriorated within 6 hours of the procedure. The flag was in the system, Mara said. The formal notification to the attending isn't documented anywhere in the file, which means either it was communicated informally and not recorded, or it wasn't communicated at all. Sorensen was very still. How long have you had access to this file? I found it 5 weeks ago when I was reviewing my own documentation for the review process. It appeared in a related search. I read what I had access to, noted it, and didn't know what to do with it yet because I didn't have full context. And the text message you received in the corridor just now. Mara had told her about the message. I don't know who sent it, but whoever it was knows the file exists and knows it matters. Sorensen took off her reading glasses entirely and set them on the desk. She had the expression of a woman performing rapid internal calculations. You understand that what you're describing, if it's accurate, is significantly larger than the complaint currently before this panel. Yes, and you're bringing this to me now, before the panel reconvenes, before you know how the panel is going to rule on the complaint against you. If I brought it afterward, it would look like I was using it as leverage. Sorensen looked at her steadily. Some people would. I know. Mara met her eyes. I'm not some people. A pause that was not uncomfortable exactly, but carried weight. Then Sorensen picked up her desk phone and dialed an internal extension. The panel did not reconvene at the scheduled time. Mara was asked to wait in the corridor. She waited. She used the time to send a single text back to the unknown number. Who is this? The reply came in 40 seconds. Petra Holloway. Ward 3 night shift. I have the full file. I've had it for 2 months. I didn't know who to give it to. Mara looked at that for a long moment. Petra Holloway was a name she knew distantly, a night shift nurse she had passed in the corridor twice, exchanged 3 words with at a department-wide meeting in September. A quiet woman, mid-40s, who worked the overnight rotation on the surgical recovery ward and who Mara had registered as competent and unbothered in the way of someone who had made her peace with her professional circumstances. She typed back, "How did you know to reach me? I heard what happened in the trauma bay, and I saw your documentation style on 2 shared patients last fall. You document like someone who knows records matter. So I took a chance. Mara sat with that for a moment. Then she typed, "Are you willing to submit a formal statement?" The reply took 90 seconds, which was not fast, but was faster than she'd expected. "Yes. I've been trying to figure out how to do it safely." I didn't know if anyone would listen. "They'll listen now," Mara wrote. "Can you come to the administration building?" "I'm in the parking lot," Petra wrote. "I've been sitting here for an hour." Petra Holloway was compact and gray-eyed, with the residual tension of someone who had been carrying something heavy for longer than was good for them. She met Mara in the first-floor lobby with a manila envelope under her arm and the expression of a person who has finally done the thing they've been building toward and is now discovering that doing it doesn't immediately feel the way they expected. "I pulled it from the archived records after the case was moved to Quality Committee," Petra said. They were standing near the lobby's east wall, out of the main foot traffic. "I work the surgical recovery ward. Orana Vasic was my patient on the night she deteriorated. I filed the observation flag at 11:40 p.m. I documented it in the system. I told the charge nurse on duty. The charge nurse said she'd notify Dr. Hartwell. And the next morning, Vasic was in a critical state. And when I asked whether Hartwell had been reached about the medication concern, the charge nurse told me she'd called but hadn't been able to get through and had left a message." Petra stopped. "There's no record of that call. I looked. It's not in the phone log. It's not in the nursing notes. It's not anywhere. The only record is my original flag." Mara absorbed this. The specific gravity of it was not lost on her. A flag filed. A patient deteriorated. A mortality outcome. And the link between those two events, the communication that should have connected them, absent from every record that existed. "What's in the envelope?" she asked. "My original flag documentation, a copy of the patient chart from that night, and a printout of the internal phone logs for the ward from 11 p.m. to 2 a.m. Petra held the envelope with both hands. "I've been carrying this for 2 months. I didn't know if bringing it forward would cost me my job." "It might still," Mara said, because she wasn't going to tell Petra Holloway comfortable things that weren't true. "But not bringing it forward costs something else." Petra looked at her. "You know, I heard you were cold. The nurses on the day shift say you're impossible to read. They're not wrong. They're a little wrong." She held out the envelope. "You came back to a hospital that had you on suspension, and you saved someone's life. And now you're standing in a lobby talking to a night shift nurse you've met twice. That's not cold. That's just..." She seemed to search for the word and not quite find the one she wanted. "Different." Mara took the envelope. "Can you be in, doctor?" "Sorensen's office in 15 minutes? I've been in the parking lot for an hour," Petra said. "I can be anywhere." The next 90 minutes moved with the peculiar, compressed quality of institutional proceedings, when they are operating outside their normal pace. Sorensen reviewed Petra's materials. She made calls. One of them was to the Quality Committee chair, whose office was in the East Wing, and who arrived in Sorensen's office, looking like a person who had not expected his Tuesday to develop in this direction. Mara was not in those conversations. She was in the corridor again, in the chair by the water fountain, which she was beginning to feel a complicated relationship with. She had eaten nothing since 7:00 a.m., except half a granola bar she'd found in her bag. She was aware of this fact the way she was aware of most physical states noted, cataloged, not currently actionable. Colonel Warwick found her at 4:20. He sat in the adjacent chair without being invited, which was fine. "Things have moved," he said. "Yes, Sorensen briefed me on the Vasic case." Informally. He paused. "I want to be clear that I'm not here in any official capacity with respect to that matter. My role is limited to Specialist Voss. I understand. But I want you to know that what you did this afternoon, bringing the file to Sorensen before the panel ruled, is the kind of decision that tells you a lot about a person." She looked at him. It was the right sequence. Most people in your position would have used it as a card to play. It's not a card. It's information about a patient who died. That's different. He was quiet for a moment. How's Voss doing? She asked. Stable. Extubated an hour ago. Asking about her team. A trace of something crossed his face, not sentimentality exactly, but the genuine relief of a man who has lost people in his career and knows the weight of the alternative. She asked who did the chest tube. Carver told her. She said. He stopped, almost smiled. She said she'd like to say thank you when she's not attached to 3 machines. She doesn't need to. Carver also said something else. Warwick's voice shifted slightly. He said you handled that needle like someone who'd done it in the back of a moving vehicle. Mara said nothing. Have you? She looked at the wall. The moving part was a helicopter, technically. Warwick was quiet for a moment that held its own kind of recognition. Then he said, they're going to rule tonight. Sorensen told me the panel is combining the original complaint review with a preliminary assessment of the VASIC information. It'll all go through the peer review committee and probably to the state medical board from there. That's a larger process. I know. What I don't know, he said, is where Hartwell is in all this right now. Mara had been wondering the same thing. Preston Hartwell had not left the building. He was in a small conference room on the 2nd floor, not the formal panel room, but a working room with a whiteboard and a table that was too large for the space, and he was sitting across from the hospital's legal counsel, a man named Desmond Foyle, who was 57 and had the particular quality of stillness that lawyers develop when they are managing a situation that has the potential to be significantly more expensive than the situation they walked into. Foyle had been in this building since 3:45, which meant he had arrived within 12 minutes of Sorensen's call to the legal department, which told anyone who was paying attention exactly how seriously the institution was now treating the VASIC information. Hartwell had not wanted a lawyer present. He had said so, clearly, and Foyle had explained with the patience of a man whose entire professional existence was built on explaining things to people who did not want to hear them, that the hospital was not providing Hartwell a lawyer. Foyle represented the institution, not Hartwell personally, and that was an important distinction Hartwell should sit with. Hartwell was sitting with it. He was also sitting with the specific and unwelcome clarity of a man who has spent 2 years making decisions that seemed locally defensible in isolation, and is now watching someone arrange those decisions in sequence for the first time. The medication flag, the mortality, the gap in the communication record. The quality committee review, he had been told, was routine, which he had chosen to treat as routine, which he now understood was not a choice that would continue to look the way it had looked when he made it. The VASIC case is outside the scope of this afternoon's disciplinary review, Foyle said. He had said some version of this 4 times, in slightly different arrangements, which told Hartwell that it was the thing Foyle most needed him to understand. What happens with that case goes to peer review and potentially beyond. That is a separate track. I know it's a separate track. What I need you to understand is that your conduct in this afternoon's panel, specifically the characterization of Ms. Delgado's actions during the mass casualty response and the subsequent intervention, is going to be reviewed in the context of everything that's emerged this afternoon. I characterized her actions accurately. Foyle looked at him with the expression of a man who has heard many things called accurate. Dr. Hartwell. A patient with a tension pneumothorax and an oxygen saturation of 80% was decompressed, treated by a nurse with 3 combat deployments and a clinical record. That includes emergency thoracostomies under active fire. The panel cardiologist asked you directly what your plan was in the 30 seconds before her intervention, and your answer was imaging. Hartwell said nothing. The documentation from the mass casualty response this morning, the medication flag, the compartment syndrome catch, the pneumothorax observation, all of it is now part of the formal record. The pattern it describes is, Foyle paused, choosing words with the care of a man laying a floor, not the pattern your complaint described. She inserted herself into clinical situations without authorization. She documented accurate clinical observations that led to positive patient outcomes. 11 months of them. Foyle set down his pen. Preston, I need you to hear me. The question before you, right now, is not whether you were right about her. The question is what position you take going forward, because that position will matter when the VASIC review opens formally. Hartwell looked at the whiteboard. Someone had written a scheduling grid on it in blue marker, some other department's problem from some other day. He stared at it for a moment without seeing it. The Orana Vasic case, he said slowly, was reviewed by the quality committee. Yes, I was told it was within standard deviation for postoperative outcomes. You were told that in March, the committee's preliminary finding. Foyle looked at him carefully. What wasn't part of that finding, because it wasn't available to them at the time, was a documented medication concern flag filed the night before the patient's deterioration, with a corresponding gap in the follow-up communication record. Hartwell's jaw moved slightly. It was not a word. It was the physical manifestation of something he was deciding not to say. Who filed the flag, he asked. A night shift nurse on the surgical recovery ward named Petra Holloway. Foyle picked up his pen again. She's in Sorensen's office right now. Mara was called back into Sorensen's office at 5:15. Petra was still there, seated in a second chair that had been brought in from somewhere. The quality committee chair, Dr. Leonard Bast, whose expression had not improved since his arrival, was standing near the window with his arms crossed in the unconscious posture of a man defending himself from information. Sorensen looked tired in the specific way of a person who has been managing the collision of multiple serious things simultaneously and is keeping it together through professionalism and stubbornness. We've completed a preliminary review of the materials provided by Ms. Holloway and cross-referenced them against the panel documentation from today. I want to be transparent with both of you about where this stands. She looked at Mara first. The original complaint filed by Dr. Hartwell is going to be dismissed. The documentation you provided this morning, combined with the clinical record from the Voss intervention, does not support the characterization of your conduct as unsanctioned overreach. The panel's recommendation will be to clear the complaint from your personnel file and lift the administrative hold immediately. Mara nodded once. The VASIC matter is separate and will be handled through peer review, which is the appropriate process. That process is not fast, but I want you to know that the information you brought forward this afternoon and Ms. Holloway's documentation will be part of that process. Sorensen paused. I also want to say, and I want to say this clearly, that what you did this afternoon took integrity that I don't take for granted. You were in the middle of your own disciplinary proceeding, and you had information that was relevant to a larger problem, and you chose to bring it forward in a way that was transparent and documentable rather than strategic. Mara didn't say anything. Is there anything you want to ask me? Sorensen said. Mara thought for a moment. The night shift nurse who filed the original VASIC flag. Is her position protected through the peer review process? Sorensen looked at Petra. Miss Holloway submitted her materials voluntarily as part of a quality safety disclosure. Under the hospital's whistleblower protections, that gives her formal status as a reporting witness. Her position is protected. Petra let out a breath that she had possibly been holding since the parking lot. One more thing, Mara said. When the peer review process is complete, whatever the outcome, I'd like the quality flag communicating protocol reviewed. Not just for this case, for the system. There should be a documented confirmation requirement when a safety flag is filed. The flag goes in, the attending gets a documented notification. There's a timestamp on both ends. No gap. Bast looked at her from the window. That's a systemic process change. Yes, Mara said. It is. Bast looked at Sorensen. Sorensen looked at him. Something moved between them that was not quite agreement and not quite disagreement, but occupied the space where institutional change begins to form before anyone has committed to it in writing. She was in the main corridor, putting on her jacket when Hartwell came around the corner. It was not planned. He came from the direction of the legal counsel's conference room, and she came from Sorensen's office, and the corridor was not wide enough for either of them to pretend the other wasn't there. They stopped. He looked older than he had this morning, which was not a physical thing. It was the quality that people acquire when the internal account of themselves has been significantly adjusted in a short period of time. It didn't make him sympathetic, exactly, but it made him human in a way that his morning presentation had not. He said, "I didn't know about the Vasek flag." She looked at him steadily. "I know, that's—" He stopped. "I'm not saying that to excuse anything. I'm saying it because it's true and because I think it matters that you know I'm not—" He stopped again. He was not a man accustomed to not knowing how to finish his sentences. "I should have known. That's the point. If the system was working the way it should, I would have known." "Yes," she said, "you would have." He looked at her for a moment with an expression that she didn't try to categorize. "You're a better clinician than I gave you credit for." It was possibly the most honest thing he had said all day, and she received it the way she received most things without performance, without the satisfaction of having waited for it, just as information. "I know," she said, and she turned and walked to the elevator. The drive home was 20 minutes on empty roads, the kind of late afternoon quiet that settles over a small city when the workday is ending and the evening hasn't started. The mountains were dark and present to the west, and the sky above them was doing the thing Colorado skies did in autumn, going from blue to orange to something between charcoal and violet in a progression that demanded attention even when you were too tired to give it. She parked in front of her apartment building and sat in the car for a few minutes. She was not processing. Exactly. She was doing the thing that comes after high-consequence events when the operational mode has been running so long that the body needs a moment to locate itself in ordinary time. She had learned to give it that moment rather than push through into the next task, because push through led to a specific kind of degradation she had once made the mistake of ignoring. She thought about Dana Voss, breathing in the ICU. She thought about Petra Holloway in the parking lot for an hour, with an envelope, trying to figure out who would listen. She thought about Orana Vasek, who was not recoverable, and about the flag that had been filed and the call that had no record, and the night that had ended the way it had ended. The weight of that one did not resolve. It wasn't supposed to. The peer review process would do what it did, and the board would do what it did, and the outcome would be whatever it was. That was the appropriate scale for what Orana Vasek's death was. Not a data point in her personal case, not a weapon, but a life that deserved to be accounted for with the same rigor that she applied to everything else. She got out of the car. She was halfway to the building entrance when her phone rang. "Unknown number different from Petra's," she answered. The voice was professionally modulated and identified itself as belonging to a senior investigator with the Colorado Medical Board's Professional Conduct Division. "Ms. Delgado," he said, "my name is Raymond Vela. I apologize for the late hour. I understand today has been a significant day for you." "It has been," she agreed. "I'm calling because we've been in contact with Dr. Anita Sorensen at Harrow Peak Medical Center, and she has indicated that you may have information that is directly relevant to an active investigation." A pause. I want to be clear that this call is not compulsory. You are not a subject of any investigation. But if you are willing to speak with us, what you know about the Vasek case and about the pattern of documentation you've observed over the past 11 months could be significant. Mara stood at the entrance to her building. The door was in front of her. The sky above the mountains had reached full violet. "I'll speak with you," she said. "When?" "I can be at Harrow Peak Medical Center tomorrow at 9 a.m. Or, if you prefer a neutral location, the hospital is fine," she said. "I'll be there at 9. She hung up and went inside. She ate something, finally. She showered. She sat at her kitchen table with the notebook open in front of her and wrote the final entry for the day in the same format as every other entry: date, time, event, individuals present, outcome. It took 6 minutes. When she was done, she closed the notebook and set it on the table. She was not thinking about tomorrow, not in the anticipatory way that worry operated. She was thinking about the documentation she had kept for 11 months and the specific quality of attention required to maintain that kind of record, the discipline of writing things down, even when it seemed like no one would ever read them, even when the pattern was invisible, because it was being examined one day at a time. The pattern had been there the entire time. She had not built a case. She had done her job and documented it, which was what she would have done regardless, because she was the kind of person who understood that the record was the work, and the work was the record, and neither one was meaningful without the other. She was thinking about this when her phone buzzed again. Text from Colonel Warwick. Voss asked about you again. She wants to know your rank. Mara looked at that for a moment. Then she typed back, "Tell her I'm a nurse." She put the phone down. Outside the window, the mountains were completely dark now, which meant they were still there, just not visible from where she was standing, which was a condition she had long since stopped confusing with absence. She went to sleep. She had an appointment at 9 a.m. with a man from the State Medical Board, and she had 11 months of documentation in a notebook on her kitchen table. And somewhere in the ICU at Harrow Peak Medical Center, a 26-year-old specialist was breathing on her own. Tomorrow the real accounting would begin, and when it did, Hartwell would be sitting across from people who already had the file, and the file had a timestamp, and the timestamp did not say what he needed it to say. The timestamp did not say what he needed it to say. That was the fact Hartwell woke up to on Wednesday morning, though he had not slept in any meaningful sense of the word. He had lain in the dark of his house on the west side of Crestfall and stared at the ceiling and done the thing he had been trained his entire career not to do, which was run the same sequence of events through his mind in the same order and arrive at the same conclusions, without finding any new exits. The medication flag had been filed at 11:40 p.m. on March 14th. That timestamp was in the system. It was not going away. It had been there since March, and it had been sitting in the Quality Committee file, and it would now be sitting in front of Raymond Vela at the Colorado Medical Board, who was, by professional reputation, a man who read files with the patience of someone who understood that institutional negligence rarely announced itself and usually had to be located in the space between what was documented and what was not. What was not documented was the notification to Hartwell. What was also not documented, and this was the part that had kept the ceiling interesting all night, was the fact that the charge nurse on duty that night, a woman named Sylvie Parrott, had been hired at Harrow Peak 18 months ago, after leaving her previous position at a facility in Grand Junction, where Hartwell had also worked. That connection was not on its own evidence of anything. People from the same professional network ended up at the same institutions all the time. But Sylvie Parrott had been the one to tell Petra Holloway that the notification call had been made. And the phone logs did not show that call. Hartwell knew why. He had known since the moment Foyle said Petra Holloway's name in the conference room, though he had not acknowledged it to Foyle and had not written it anywhere and had not said it out loud, because saying it out loud was not yet something he had to do, and he was operating in the diminishing space between having to do something and being able to choose not to. He got up at 5:30, made coffee he didn't drink, and drove to the hospital. Mara arrived at Harrow Peak at 8:45 and found Raymond Vela already in the lobby with a leather briefcase and the particular punctuality of a government investigator who understood that arriving early was itself a form of communication. He was mid-50s, Hispanic, with reading glasses in his breast pocket, and a handshake that was brief and genuine. "Ms. Delgado," he said, "thank you for coming. I said I would." They were given use of a small conference room on the first floor, not the panel room, a different one, which Mara registered as intentional on someone's part and didn't comment on. Vela set his briefcase on the table and opened it with the practiced efficiency of someone who had done this specific thing many times and had organized the materials to support that efficiency. "I want to start by clarifying the scope of what I'm looking at," he said. The medical board opened a preliminary inquiry into Dr. Hartwell's conduct following a referral from this hospital's quality committee in March. The Vasic case was the trigger for that referral. But in the course of reviewing the referral documentation, my office identified 3 additional cases from Hartwell's previous facility in Grand Junction that share structural similarities with the Vasic outcome. Mara looked at him. Three cases over a 4-year period where a patient safety flag was filed by nursing staff. The documented notification to the attending was absent or incomplete, and the patient experienced a significant adverse outcome within 12 to 36 hours. He said it in the level tone of a man who had moved past the point of being shocked by the information and was now in the phase of building its architecture. The Grand Junction cases were reviewed internally at the time. Each was attributed to clinical complexity and patient factors. None triggered external review, because each one looked defensible in isolation, Mara said. Correct. It's only when you lay them in sequence that the pattern becomes. He paused, choosing the word. Legible. She had used that word in her own head 11 months ago, almost exactly. The documentation she had kept was not about any single incident. It was about what the incidents looked like when you could see all of them at once. "What do you need from me?" she asked. "Your documentation of the 11 months you've worked here. Specifically, any instances where a safety flag or clinical concern was communicated upward, and the response or lack of response was notable." He looked at her across the table. "I've reviewed the disciplinary panel materials from yesterday. You were organized in a way that suggests you understood early that a single incident wouldn't be sufficient. I understood that accurate records were worth keeping. That's not the same thing, isn't it?" She thought about this for a moment. "I kept records because it's what I do, not because I was building a case against anyone." "I believe you," Vela said. "But what you built as a byproduct of doing your job correctly is a chronological record of a pattern. And that record, combined with the Vasic documentation and the Grand Junction files, is going to be central to what happens next." She opened her bag and put the notebook on the table. She had spent 40 minutes at 6:00 a.m. making a complete photocopy at the library, 3 blocks from her apartment, because she was not going to hand anyone the original of something she had maintained for 11 months. The photocopy was rubber-banded beside the notebook. She slid both across to Vela. He looked at the notebook. Then he looked at her. "You kept a physical record. Digital records get accessed and modified. Paper records get found or they don't." He picked it up and opened it to the first page. He read for 30 seconds without speaking. Then he looked at her with an expression that was not quite admiration. It was more like the recognition of someone encountering a working method they had seen before in people who understood at a fundamental level what evidence actually was. "I'm going to need 2 hours with this," he said. "Take whatever you need." She stood. "I have a ward to get back to. I was reinstated as of last night. The trauma floor on a Wednesday morning after a mass casualty Tuesday had a specific quality of exhausted normalcy, the kind of calm that follows intensity, not because everything was resolved, but because the people who worked there had no choice but to reabsorb themselves into the daily work and leave the previous day's extraordinary events in whatever internal compartment allowed them to keep functioning." Mara changed into scrubs, clocked in for the first time in 4 days, and went to work. It was not dramatic. There was no moment of acknowledgement, no collective recognition from the floor staff. Dolores nodded at her from across the nursing station. Obi, who had handed her the chest tube tray the day before, said morning, with the calibrated neutrality of a man who was neither going to make a thing of it nor pretend it hadn't happened. A second-year resident, Dr. Ferris, who had been on the floor for 2 weeks and had not yet developed strong opinions about the departmental politics, just handed her a chart and asked if she had a minute to review a patient in Bay 8. She had a minute. She reviewed the patient in Bay 8. This was what returning looked like. Not vindication as an event. Vindication as a return to the work, which was the only place where it was real. She was 3 hours into the shift, midway through documentation at the nursing station, when Dolores sat down beside her. Not to give her a task, just sat. Sylvie Parrott called in sick this morning, Dolores said. She said it in the careful tone of someone relaying information that carries more weight than the sentence itself. Mara kept her eyes on the chart. Okay, she's never called in sick on a Wednesday. She's been here 4 years, and she specifically doesn't call in sick on Wednesdays because Wednesday is when the surgical recovery census is highest. Dolores paused. I don't know what that means. It might not mean anything. It might mean she knows the investigator is here. Mara looked up from the chart. Dolores was watching her with the expression she had been wearing since yesterday afternoon in the corridor, the one that was recalibrating in real time. Dolores. Whatever Sylvie Parrott knows or doesn't know is not something I have any control over. The investigator has the phone logs. He has Petra's documentation. What Sylvie does or doesn't do today is her decision. I pushed the original complaint through, Dolores said. Not because I thought you were dangerous. Because Hartwell asked me to, and I told myself the observations were a pattern of boundary issues rather than a pattern of clinical competence. She said it flatly, without the softening she might have applied 24 hours ago. That was wrong. I want to say that directly, rather than in some soft version. Mara looked at her. I wrote it down, she said. Your correction. From yesterday. It's in the record. Dolores blinked. You included my admission in your documentation? Accurate record means accurate record. Something moved across Dolores's face that was not comfortable, but was real. That's either very fair or very ruthless. The investigator will decide what's relevant, Mara said. I just document. Dolores stood. She seemed about to say something else, then reconsidered and returned to her side of the nursing station. Mara returned to the chart. 20 minutes later, her phone buzzed with a text from Petra Holloway. Sylvie called me this morning. She wanted to know what I gave the investigator. Mara read that twice. She typed, Did you tell her? I told her I gave him everything I had. She hung up. Mara put the phone down and looked at the nursing station wall for exactly the amount of time it took to make a decision. Then she picked up the desk phone and called Vela's conference room. He answered on the second ring, Ms. Delgado. The charge nurse on duty the night of the Vasek flag, Sylvie Parrott, called in sick this morning. She also called Petra Holloway within the last hour to ask what had been submitted to your office. She said it without embellishment. I'm informing you because it's potentially too relevant to your process. What you do with it is your decision. A pause. Thank you. His voice was the same level it had been all morning, but there was a quality of attention in it that suggested she had handed him something useful. I'll note it. She hung up and went back to work. Hartwell's clinical privileges were suspended at 11:00 a.m. It was not announced over the intercom. It appeared in the internal staffing system as a status change, name moved from the active attending roster to an administrative hold designation, and the people who needed to know were informed by direct communication from the medical director's office. Patients currently under his care were reassigned to other attending physicians. Scheduled procedures were transferred. It happened with the quiet bureaucratic efficiency of an institution managing liability, which was not the same as accountability, but was the form that accountability initially took in a hospital setting. Mara knew about it because OB, who had a peripheral awareness of departmental administrative changes that was one of his more useful professional qualities, mentioned it to her at the medication station at 11:20. Hartwell's off the board, he said, pending review. She nodded and returned to what she was doing. But the information settled into her in a way that was different from the satisfaction she might have expected. It was not a relief, exactly. It was the specific weight of a consequence arriving, which had its own gravity regardless of whether it was deserved, and it was deserved, but that didn't make the weight of it lighter. A man's career was in a condition of serious uncertainty. Patients who had been under his care were now with different physicians. A woman named Orana Vasic was still dead. The consequence wasn't the ending. It was a door opening onto a longer process, and the longer process was the part that would determine whether the consequence meant something. She kept working. At 1:30, Vela knocked on the trauma bay door and asked if she had 20 minutes. They used the break room, which was empty at that hour, because the incoming shift was still in handover briefings. He set the notebook on the table between them. I've completed my initial review of your documentation. I want to ask about 3 specific entries. She told him which 3 they would be before he named them, because she knew her own record, and because the 3 that would interest a medical board investigator were the 3 that had the clearest connection between a nursing observation, a delayed or absent attending response, and a negative patient outcome. She was right. He named the same 3. They went through each one. He asked precise questions, and she gave precise answers, and he wrote things down in a legal pad with the focused economy of someone extracting what he needed without manufacturing more than the record supported. He was a careful man in the best sense of the word, careful meaning he did not reach further than the evidence took him, which was exactly the quality the situation required. At the end of the 20 minutes, he closed his legal pad. I need to ask you something that's outside the formal scope of this interview. Okay? When you first started documenting, when you first began keeping this record, what did you think would happen with it? She thought about this honestly, because it deserved an honest answer. I thought I would leave this hospital eventually and apply somewhere else. And if my employment record was challenged, which I expected it to be, based on how things were going, I would have accurate documentation to show that my clinical judgment was sound. She paused. I didn't know it would be relevant to anything larger than that. You weren't documenting for a whistleblower proceeding. I was documenting because I saw things, and writing them down is what you do with things you see. He looked at her for a moment. That's the most functional definition of clinical documentation I've heard. In about 12 years of doing this job. She didn't say anything to that. One more thing, he said. Sylvie Parrott, are you aware of any direct interaction between her and Dr. Hartwell outside of normal clinical operations? Mara had thought about this. She had thought about it specifically and carefully because the answer she had was not conclusive, and she was not going to represent inconclusive observations as conclusions. I have no direct knowledge of any improper contact between them. What I have observed and what is in the notebook is that on 2 occasions, when I flagged concerns about patients on the surgical recovery ward, the response from the attending was notably delayed compared to the urgency of the flag. Both times, Sylvie Parrott was the charge nurse on duty. I documented the timing. I didn't document a reason. You documented the timing, Vela repeated. Yes. He looked at the notebook on the table. The timestamps you have for those 2 incidents match the timestamps in the system records I pulled from the hospital's documentation logs. A pause. They also match the timestamps I identified in the Grand Junction files for 2 of the 3 cases I mentioned earlier. Same structural pattern. Flag filed. Attending notification absent. Patient deterioration within the window. The room was very quiet. The charge nurse on duty in the Grand Junction cases, Mara said. Vela looked at her steadily. Sylvie Parrott worked at the Grand Junction facility for the final 18 months of her tenure there. She and Dr. Hartwell overlapped for 14 of those months. The information reorganized itself in Mara's mind the way clinical information reorganized when the differential narrowed to a single diagnosis, not a dramatic shift, but a settling, a clarity that made the preceding uncertainty feel obvious in retrospect. She didn't fail to make the notification call, Mara said. It was not a question. That is what the evidence is beginning to suggest, Vela said carefully. I want to be precise. It is what the pattern suggests. What it constitutes, legally and professionally, is what the investigation will determine. She nodded. Is there anything else you need from me today? Not today. He stood and picked up his briefcase. Ms. Delgado, I want you to know that what you've provided today has materially advanced an investigation that has been stalled at the preliminary stage for 8 months. He said it without ceremony, just as fact. The cases in Grand Junction were reviewed in isolation. Without a pattern to connect them, they were defensible as individual outcomes. What you built over 11 months in this facility is the connective tissue. She looked at the notebook on the table. Can I have that back? He slid it across. I have the photocopy. She picked it up. It was the same weight it had always been. Slightly warped at the spine from being carried in her pocket, the cover worn at the corner where it had rested against her phone. 11 months of dates and times and clinical observations written in her handwriting, which was small and consistent and took up less space on the page than most people's writing did, which had always suited her. Thank you, she said. She meant it for the professional conduct, not the compliment. She went back to the floor. The afternoon brought its own rhythm. 3 new admissions from a 2-vehicle accident on Route 9, a pediatric case that required a specialist consult from Denver, a post-operative patient from the morning's surgical schedule who spiked a fever and needed a workup. Mara moved through all of it with the focused, unglamorous attention of a nurse doing the actual work of a trauma floor on an ordinary Wednesday afternoon. And it was, in a way that she would not have been able to explain to someone who hadn't spent time in high-consequence roles, a genuine relief. At 4:15, she ran into Dr. Ferris, the second-year resident outside Bay 5. He was holding a chart and frowning at it with the specific frown of a young doctor who has encountered a lab result that doesn't match his clinical picture. I've got a post-op in 5 with a troponin that's 3 times the upper limit and a rate in the 90s, he said. Chest film is clear. No respiratory symptoms. She looked at him. What was the procedure? Laparoscopic repair. She's 63. History of hypertension. No prior cardiac events. Perioperative demand ischemia, Mara said. Get a cardiology consult and a 12 lead. Don't wait for the next troponin to decide. Ferris looked at her for a moment. He was young enough that he was still in the phase of deciding whether to push back on clinical input from nursing staff or accept it and move. He made his decision in about 2 seconds. Yeah, okay. He was already walking. She watched him go with the quiet satisfaction of a process working the way it was supposed to work. Dolores appeared at her elbow. You're covering Petra's ward for the next 2 hours. She had to give a formal statement to the investigator. I need someone who knows the surgical recovery census. I know it. I know you do. Dolores handed her the assignment sheet. Something in her manner was different, not warm. Exactly. Dolores was not a warm-mannered person, but there was an absence of the faint friction that had been present in every professional interaction they'd had for 11 months. Mara, for what it's worth. The nurses in this department are watching what's happening. The ones who've been here a while, they're paying attention. They're paying attention. To what? To the fact that you didn't blow this up. You could have gone to the board directly, gone to administration with everything you had, made noise, involved the press. Dolores looked at her. You didn't. You kept your head down, kept your records, went through the right channels, even when the right channels were being used against you. That's not restraint, Mara said. It's how the process is supposed to work. If I bypass it, I undermine the same structure that's going to hold Hartwell accountable. Dolores looked at her for a moment with an expression that was arriving at something. Is that what you were thinking when you decided not to go outside the institution? It's what I think in general. Dolores made a sound that wasn't quite a laugh, but occupied adjacent territory. "You're a very strange person to work with, Delgado," been told. She took the assignment sheet and went to the surgical recovery ward. Sylvie Parrott arrived at the hospital at 5:45 p.m. She had not called ahead. She walked in through the staff entrance on the north side of the building, badged through the security door, and went directly to the second floor administrative wing, which was where the investigators' conference room was. She was carrying nothing except her phone and her badge, and she was moving with the energy of someone who has spent a day in an escalating state of something and has finally decided that forward is the only direction available. Mara was in the surgical recovery ward when OB texted her, "Parrott just came in." "She's upstairs." She read the text and kept doing what she was doing. She was aware that she had no role in whatever Sylvie Parrott was doing on the second floor, and that her role was here, in this ward, with these patients, and that the investigation would proceed on its own track, regardless of whether she was watching it happen. She also knew from the particular quality of the day, from the weight of what Vela had described in the break room, that Sylvie Parrott, walking into that building, voluntarily, unannounced. At the end of a day she had spent calling people and asking what had been submitted, was not the behavior of someone who was uninvolved. Innocent people avoided contact with investigators when they were scared. They also walked into conference rooms voluntarily when they had calculated that preemptive cooperation was better than being found. Mara had no way of knowing which of those things Sylvie was doing. She finished her ward round, updated the census documentation, and handed off to the incoming night shift at 6:30. She changed out of her scrubs in the locker room. She put on her jacket. She was at the staff exit when Vela's name appeared on her phone. She answered. "Ms. Delgado," he said, "I'm going to need you to return to the building tomorrow morning." Sylvie Parrott has agreed to provide a formal statement. "And I have something I need to show you, documentation that came to light in the past 2 hours that you will want to see before the peer review committee convenes on Thursday." "What documentation?" she asked. A brief pause. The Grand Junction facility's internal communication logs from the 3 adverse outcome cases. "I requested them through the board's administrative access this morning, and I received them an hour ago." Another pause. "One of them contains a message exchange between Parrott and Hartwell that occurred 4 hours after the medication flag was filed in the Vasic case." Mara stood at the staff exit door. "What does it say?" she asked. "Dr. Hartwell's message to Parrott is 3 words, Vela said. And her reply is 2. The door was cold under her hand. Outside, the parking lot was lit in the flat orange of sodium lights, and the mountains beyond were invisible in the dark, but they were there, the same as always. "Tell me tomorrow," she said. "I'll be there at 8. She hung up. She pushed the door open and walked to her car, and she did not let herself speculate about the 5 words that had passed between Hartwell and Parrott 4 hours after Orana Vasic's medication flag sat unanswered in a system that was supposed to protect patients, because speculation was not documentation, and documentation was the only thing that had ever mattered here. And tomorrow morning she would sit across from Raymond Vela and read the actual words. And the actual words were already in an evidence file. And there was nothing she needed to invent. The night was cold and clear, and she drove home with both hands on the wheel. And slept the way she had learned to sleep in environments where sleep was a resource rather than a comfort, deliberate, efficiently, without negotiation. The alarm went off at 6:00 a.m. She made coffee, ate, and was at Harrow Peak by 7:52. 8 minutes early, which was not a statement. It was just how she operated. Vela was already in the conference room with 2 file folders and a legal pad that had significantly more writing on it than yesterday's. He looked like a man who had also not spent much of the previous evening doing anything other than working, but who was not bothered by that fact. There was a quality of forward momentum in the room that Mara registered the moment she sat down. "The message exchange," she said. He opened the first folder and slid a single printed page across the table. It was a screenshot of an internal messaging system, the kind that hospital networks used for non-urgent staff communication, the kind that generated automatic timestamps and was theoretically archived for administrative purposes and was, in practice, rarely examined unless someone was looking. The Grand Junction facility had produced it through the board's administrative access request, and the timestamp at the top of the thread was 3:47 a.m. on the date in question, which was 4 hours and 7 minutes after Orana Vasic's medication flag had been filed in the Harrow Peak system. But this was not a Harrow Peak message. This was from 9 months before Vasic. This was from Grand Junction. From the third of the 3 adverse outcome cases, Vela had mentioned a patient named Russell Cade, 71 years old, post-surgical, whose medication flag had been filed at 11:23 p.m., and whose condition had deteriorated critically by 3:00 a.m. The exchange was between 2 usernames, Dr. Hartwell and charge nurse Sparrett. At 3:47 a.m., Dr. Hartwell had written, "Did you handle it?" At 3:51 a.m., charge nurse Sparrett had written, "Already done." Mara read it twice. Then she set it down on the table with the careful flatness of someone placing an object that has weight. Russell Cade, Vela said. Filed a medication concern at 11:23. Deteriorated by 3:00 a.m. The attending notification, Hartwell has no record in the system. Cade survived, but sustained significant cardiac damage that altered his long-term prognosis. His family filed a complaint 3 months later that was reviewed internally and closed. He paused. The complaint was reviewed by the same quality committee that closed it. Hartwell's sat on that committee. The room held its own kind of stillness. He reviewed his own case, Mara said. The committee structure at Grand Junction did not formally prohibit the attending of record from participating in quality reviews of their own cases. It was an institutional oversight. Vela's voice was level, but there was something underneath it. It has since been corrected, after a different incident unrelated to Hartwell 2 years ago. Mara looked at the printed page. The 2 lines of text. "Did you handle it? Already done." 5 words between 2 people at 3:47 in the morning and a patient who had survived but carried the consequence of those 5 words in his heart function for whatever years remained to him. "Orana Vasic," she said. The Harrow Peak system doesn't have an equivalent message in their archive, either because it wasn't sent through that channel, or because it was deleted, or because the communication happened by phone and left no digital record. Vela folded his hands on the table. What we have for the Vasic case is the flag timestamp, the absent notification record, and the outcome. What we have for Grand Junction is the flag, the absent notification, and this exchange. Together, they describe a pattern of coordinated conduct. Not negligence, Mara said. Not systems failure. No. He said it with the weight of someone who has spent a career distinguishing between those 2 things and understands exactly what the difference means. The board's position is that this constitutes a pattern of deliberate interference with patient safety reporting. That is a different category of finding than clinical error. Mara was quiet for a moment. She was thinking about Petra Holloway in the parking lot for an hour. She was thinking about the quality of Sylvie Parrott's voice on the phone when she called Petra the previous morning, asking what had been submitted. She was thinking about Hartwell in the corridor, the night before saying, "I didn't know about the Vasic flag," which was true in the technical, narrow sense that the flag had been intercepted before it reached him because he had arranged across multiple facilities and multiple years for certain flags to be intercepted before they reached him. He had known about the system. He hadn't needed to know about the specific flag. The system was the knowledge. "What happens to Parrott?" she asked. She gave a full statement last night. Voluntary, no legal representation present, which her attorney is apparently unhappy about this morning. Vela's tone remained neutral. She confirmed the Grand Junction conduct. She confirmed that the arrangement continued at Harrow Peak. She stated that she had been led to believe the flags she intercepted were low priority, that Hartwell had told her the nursing staff at both facilities had a pattern of over-reporting, and that her role was to apply clinical judgment before escalating. Mara looked at him. She believed that? For a while, she may have. People accommodate a great deal when the framing is provided by an authoritative figure who benefits from the accommodation. He paused. By the time she understood what the outcomes were, Vasic, specifically, she was already implicated. So she stayed quiet until she panicked when the investigation opened. Until she calculated that cooperation was preferable to being found, he said, which was the same thing Mara had thought in the parking lot the previous evening. Her cooperation has value to the investigation. Her exposure remains significant regardless. Mara sat back in her chair, not with relief, with the weight of a complete picture settling into place, which was not the same as a satisfying picture. A complete picture of this particular thing was not satisfying. It was accurate, which was different. "What do you need from me today?" she asked. "I need your formal statement, recorded, incorporating the documentation you provided yesterday and your verbal account of the incidents during your time at Harrow Peak." He reached into the second folder. "And I need you to sign this." He slid the paper across. It was a formal witness declaration for the Colorado Medical Board's professional conduct investigation. It named her as a contributing witness. It would be part of the evidentiary record that went to the peer review panel and from there to whatever formal proceedings the board initiated. She read it once. She picked up the pen and signed it at the bottom, where the signature line was, in the space where her name was already printed. She wrote her name in the same small, consistent handwriting that filled the notebook in her bag. The peer review committee convened at 2:00 p.m. on Thursday in the hospital's main conference room, which was larger than the rooms that had hosted the previous proceedings and was configured accordingly. The committee panel on one side, the relevant parties and institutional representatives on the other, with Vela and another board representative seated at the end of the table as observers with formal standing. Mara sat in the room because she had been asked to be available. She was not presenting. She had already presented everything she had. What was happening now was the institutional machinery processing what she had given it, which was slow and imperfect and necessary, and not something she needed to manage. Hartwell was there. He had a personal attorney seated beside him. Now, a woman named Greer with sharp eyes and a controlled expression, who had clearly been briefed on the full picture and had calibrated her client's posture accordingly. Hartwell sat with his hands folded on the table and did not look at Mara. He looked like himself, mostly. The composure was still there, the physical bearing of a man who had built decades of professional identity around a particular image of himself. But it had the quality of a structure after its internal supports have been removed, still standing in shape, but something fundamental about the load-bearing was gone. The committee chair, Dr. Margot Cowteller, opened the proceedings with a procedural summary that covered the scope of the review, the evidentiary materials submitted, and the participation of the medical board's investigative office. She spoke for 8 minutes in the careful, precise language of a physician who had done this enough times to know that clarity mattered more than thoroughness in an opening statement. Then she looked at Hartwell. "Dr. Hartwell, you've been provided with the evidentiary materials in advance of this proceeding. Do you have a statement you wish to make at this time?" His attorney touched his arm briefly. He spoke, "I have reviewed the materials. I want to state for the record that I was not directly aware of the specific medication flags that were filed in the cases under review." He paused. "I created conditions that allowed for interference with patient safety reporting. I did not supervise the notification process with the scrutiny that the system required. I accept responsibility for those failures." The room was quiet. It was not an admission of deliberate coordination. It was carefully worded, shaped by counsel, positioned to acknowledge what the evidence made undeniable, while pulling back from the characterization that carried the most severe professional consequences. Mara recognized the architecture of it. She had expected something similar. Teller looked at him for a moment. Dr. Hartwell, the board's investigation has identified a message exchange from the Grand Junction facility that suggests the conduct was not solely a supervisory failure. She said it without emphasis, just as fact. I want to give you the opportunity to address that specific evidence before we proceed. His attorney touched his arm again, more firmly this time. He looked at the table. I'm not in a position to speak to that evidence at this time, which was in its own way an answer. Teller made a note. The committee will proceed with the evidentiary record as submitted. The proceeding ran for 3 hours. Mara was asked to speak twice, once to confirm the accuracy of her documentary record, and once to describe the specific incident sequence from the mass casualty day through the Voss intervention. She was precise both times. She did not editorialize. She did not describe her own emotional experience of any of it, because the committee needed clinical and procedural information, not her feelings, and she knew the difference. When she described the needle decompression and chest tube placement on Dana Voss, Dr. Huang, who was on the peer review panel, as a consultant asked her to walk through her clinical reasoning, step by step. She did. When she finished, he said, and at the moment you initiated the decompression, you were on administrative hold pending disciplinary review. Yes. Were you aware of the potential consequences of acting in that status? Yes. And you acted anyway. The patient was dying, she said. The consequences to me were secondary to the consequences to her. Huang looked at her for a moment with an expression she had seen in senior clinicians, occasionally the look of someone who is recognizing something they were taught about but rarely see in practice. He wrote something down and didn't ask a follow-up. Dolores was called to provide a statement. She sat in the chair where other people had sat and said the things she had said in the corridor 2 days ago, but formally, on record. She described the original complaint, her role in processing it, and her account of the interactions she had witnessed over 11 months. Her voice was steady. It cost her something that was visible in the way she held her posture, the slight effortfulness of it, but she did not soften the account or redirect its implications. When she finished, she returned to her seat and looked straight ahead. Petra Holloway's written statement was read into the record by Teller because Petra was in the medical building across the campus, providing a parallel formal statement to Vela's team. Her statement was 7 pages. Teller read the relevant sections in a level voice that gave the words the weight they carried without adding to it. When the reading reached the paragraph describing the night of Orana Vasik's deterioration, the flag filed at 11:40. The charge nurse informed, the notification that was promised and not made. The morning that followed the room had the specific quality of silence that occurs when people are processing, something that cannot be undone. Mara sat in that silence and did not look away from it. At 5:15, the committee adjourned to deliberate. Mara went to the trauma floor. Not because she had been called, not because she was scheduled. She just went. She changed into scrubs and picked up a chart and went to work. Because working was what she did when she was waiting for something she couldn't control, and because the floor was where she was useful, and because the patients there did not know or care what was happening 2 floors above them, and needed exactly the same quality of attention they always needed, regardless of any of it. She was in Bay 4, reviewing a 38-year-old woman's post-reduction assessment after a dislocated shoulder, when her phone buzzed. She finished the assessment, made her notes, and checked the message in the corridor. It was from Vela. Committee has issued preliminary findings. You should be here. She handed the chart to the covering resident and went upstairs. The conference room had a different quality when she walked back in. The formal configuration was the same, but the texture of it that had changed the change that settles over a room when a decision has been made, and the people in it know what the decision is and are now exchanging themselves in relation to it. Teller was at the head of the table. She looked at Mara when she entered and gave a small nod that was not warm, exactly, but was direct in a way that carried its own communication. Hartwell was still seated, but his attorney was leaning toward him in the posture of someone who has received information and is managing the next 30 seconds carefully. Teller began. The peer review committee, in conjunction with the Colorado Medical Board's investigative findings, has reached the following preliminary determinations. She spoke without looking at her notes, which meant she had internalized this before entering the room. With respect to the complaint filed against Ms. Mara Delgado, the complaint is found to be without clinical merit. The documented conduct, characterized as unsanctioned overreach, is consistent with appropriate emergency clinical judgment performed by a qualified nursing professional in the presence of immediate patient risk. The complaint is dismissed with prejudice and will be expunged from Ms. Delgado's personnel file. The phrase dismissed with prejudice meant it could not be refiled. It meant the record would show not just that the complaint was closed, but that it had been found invalid at its foundation. Mara received this in the way she received most information, steadily, without performance. With respect to the conduct of Dr. Preston Hartwell, Teller continued, the committee finds sufficient evidence to refer the following matters to the Colorado Medical Board for formal disciplinary proceedings. A sustained pattern of inadequate supervision of patient safety notification systems, resulting in documented adverse outcomes, including the death of Orana Vasic, conduct that created conditions for the interference with nursing safety reports across 2 facilities over a minimum 4-year period, and misuse of institutional disciplinary mechanisms to file a retaliatory complaint against a staff member whose documentation posed a risk to his professional standing. Hartwell's attorney was writing steadily. Hartwell was not looking at anything in particular. Dr. Hartwell's clinical privileges at Harrow Peak Medical Center are suspended indefinitely pending the outcome of the formal medical board proceeding. His case will be referred to the board with a recommendation for formal investigation of licensure standing. Teller paused. The committee further recommends that the cases involving patients Russell Cade and Orana Vasic be referred to appropriate legal counsel for review of civil liability, and that Hartwell's conduct record at the Grand Junction facility be incorporated into those proceedings. Sylvie Parrott's situation was addressed separately, pending formal board review of her professional conduct. Her Harrow Peak credentials were suspended. Her cooperative statement was noted as a mitigating factor in the board's eventual determination. Then Teller did something that was outside the formal procedural sequence. She looked at Mara directly, which the committee chair was not required to do at this juncture. And she said, "Miss Delgado, the committee reviewed the full record of your 11 months at this facility. The pattern it describes is not of a nurse who was difficult or insubordinate. It is the pattern of a clinician who refused to accept that good documentation was optional, even when the institution's culture suggested it was." A pause. "We should have caught this years ago. That we didn't is a failure that this committee owns. Your records are part of the reason we can correct it now." Mara looked at her. "Orana Vasic's family should be informed before the public record is released," she said. "That's not a committee item. It's just they should hear it from a person before they read it somewhere." Teller looked at her for a moment. "I'll make that call tonight. Thank you." The corridor outside was quieter than the room had been. Mara walked to the elevator and pressed the lobby button and rode down with a man she didn't recognize who was carrying a large potted plant and looking mildly overwhelmed by it. In the lobby, she sat in a chair near the main entrance. Not the water fountain chair, a different one, near the window that looked out onto the parking lot and the low hills beyond the hospital's property line. She sat for a few minutes and let the day be done. It was not a triumphant feeling. She had a triumphant feeling. She had expected that it would be in the part of herself that she didn't examine very often, the part that had spent 11 months watching inaccurate things be recorded about her, and had imagined, in some future-oriented version of events, that the correction of those inaccuracies would feel like a door opening into something large and light-filled. What it actually felt like was simpler than that. It felt like something being set down, like a weight that had been appropriate to carry, because the carrying had a purpose, and the purpose was now accomplished, and you could set it down without it, meaning the journey hadn't been real. Orana Vasic was still dead. Russell Cade still had cardiac damage he would carry for the rest of his life. A system that should have caught this 4 years ago had not caught it, and the reasons it hadn't caught it were not mysterious. They were the same reasons institutional failures always persisted, which was that each individual instance was defensible in isolation, and the pattern only became visible when someone kept accurate records over time. She was not the hero of that story. She was the person who had written things down. But writing things down was not a small act. It was actually the act. Everything else had grown from it. Colonel Warwick found her there. He had the particular quality of not announcing himself that military people sometimes develop not sneaking, just a controlled lack of unnecessary noise. He sat in the adjacent chair with the ease of someone comfortable with silence. Voss is being transferred tomorrow, he said. Rehabilitation facility in Denver. Full recovery projected. Good. She wants to see you before she goes. Mara looked at him. She doesn't need to. She disagrees. He let that sit for a moment. I told her a little about your record. Not the classified portions. Just enough context. How did she take it? She said, and I'm quoting directly. So she's been doing the same job in 2 completely different wars. He paused. I thought that was fairly perceptive for someone who was unconscious 24 hours ago. Something happened in Mara's face that wasn't quite a smile, but was adjacent to it. She's not wrong. No. He was quiet for a moment. What happens to you now? Here. The complaint is gone. The hold is lifted. She considered. I go back to work. Just like that. Just like that. He looked at her with the measured assessment of someone who has spent a career evaluating people under pressure. Sorensen called me this afternoon. She mentioned a senior trauma coordination position, said the committee, recommended considering you for it. Mara had not heard this. She received it without expression. That's a committee recommendation, not an offer. It will be an offer by Monday, Warwick said. Sorensen doesn't mention things accidentally. She thought about this. A senior coordination position meant oversight of documentation protocols, safety flag systems, escalation procedures. It meant being the person who built the structure that determined whether flags got through. It meant in the specific institutional sense being positioned to prevent the next Vasic before it happened, rather than documenting its aftermath. She had spent 11 months doing this work as a floor nurse, which had been the right place to do it for the 11 months it took to build the record. The question of whether this position was the right next place was a question she would think about carefully and answer correctly, which was how she answered most questions. I'll hear the offer, she said. Warwick nodded. He stood. She's in room 412. Voss. If you want to see her before the transfer, I'll go up. Room 412 was a standard ICU step-down room, with the particular organized clutter of a space that had been occupied by a person who was improving rather than declining the signs of progressive capability. The chair pulled closer to the bed, the phone charger in use, the half-eaten meal on the tray rather than the untouched one. Dana Voss was 26 years old and looked it, which was to say she looked like someone who had recently been in significant physiological distress and whose youth was doing the work of recovery with the directness that youth applied to such things. She had dark circles under her eyes and a chest tube site that would be sore for weeks, and an alertness in her expression that suggested she had been awake for long enough to have opinions about her situation. She looked at Mara when she came in and said, "You're smaller than I expected." Mara looked at her. "You're louder than I expected." Voss almost smiled. It pulled at something near her chest, and she adjusted her position slightly. Carver described the procedure, said you moved like it was muscle memory. It is. He also said you didn't hesitate when the attending told you to slow down. The attending didn't tell me to slow down. He stepped back. Same result. Different meaning, Mara said. She sat in the chair beside the bed because standing over a recovering patient for a social visit was unnecessarily formal. How's your breathing? Better than 2 days ago. Voss looked at her steadily. Colonel Warwick told me about the review, about the complaint and what happened. He talks a lot for a colonel. He's proud of you. He doesn't say it like that, but he is. Voss shifted again. I want to say thank you. I know you said I don't need to. You don't. I want to anyway, so. She met Mara's eyes directly, the way people in high-consequence roles learn to make eye contact without performance, without sentimentality, just the actual contact of one person acknowledging another. Thank you. Mara received it. You're welcome. They sat for a moment in a silence that was not uncomfortable. Are you going back? Mara asked. Voss knew what she meant. Yeah, after rehab. She looked at her hands. Some people think I shouldn't. My sister, a couple of people from training. A pause. But it's what I do, you know? Yes, Mara said. She did know. She knew it in the specific, physical way of understanding that the body, then the reasoning mind. The knowledge that there are people for whom work is not a category, separate from self, for whom the doing of a particular thing is part of what makes them legible to themselves. You could leave the role, the uniform, the institution, the title. You could take it off and walk into a different building and introduce yourself by a different designation. But the work followed you because the work was not the role. The work was the person. She had learned that over 11 months in a hospital in Crest Fall, Colorado, keeping records that nobody asked her to keep, noting things that nobody thanked her for noting, building a structure of documented truth in the margins of a clinical culture that was trying to tell her she didn't belong at the center of it. The work was the person. She stood. Get some rest before the transfer. Yes, ma'am, Voss said, with the automatic deference of someone whose training had wired the response, and then looked slightly embarrassed by it. Mara let it go. She walked to the door. Hey, Voss said. She turned. What's your rank? The actual one. Warwick wouldn't tell me. Mara looked at her for a moment. Chief Petty Officer. Retired. Voss nodded slowly. Right. Figures. She settled back against the pillow. That's exactly what you move like. Mara left. The drive home was 20 minutes, same as always. The mountains were there to the west, visible in the last light, which at this time of years and this time of evening turned the snow line on the higher peaks into something that looked briefly like the edge of something rather than just elevation. She looked at it once and then looked at the road. She parked, she went inside, she changed out of her work clothes and made dinner an actual dinner, not the granola bar and coffee that had constituted nutrition for most of the past 3 days. She ate at the kitchen table with the notebook in front of her, though she wasn't writing in it. She was just looking at it, the worn spine, the scuffed corner, the cover that had absorbed 11 months of being carried in a scrub pocket. She thought about what came next with the clear-eyed practicality of someone who had never been good at avoiding the practical. The senior coordination position, if it was offered, and if she accepted it, would be a different kind of work. It would be structural work, the work of building systems that protected the people who filed flags rather than punishing them, that created accountability at the point where information traveled between nursing staff and attending physicians, that made the VASIC situation less possible by making the gap it had fallen through harder to fall through. She was not certain she was the right person for that work. She was certain she was more suited to it than she would have been 11 months ago, before she had spent a year watching what happened when the system was operated by someone who understood how to exploit its gaps. You had to know where the gaps were before you could close them. She knew where they were. There would be people who resisted the changes. Institutional change always encountered resistance, and the resistance was rarely from bad actors. Mostly, it came from people who had normalized the existing system and experienced change as disruption rather than correction. She would have to manage that with patience and documentation, and the same quality of relentless, undramatic persistence that had gotten her to this table in the first place. She was not excited about that part, but she was not able to do it, which in her internal accounting was the relevant distinction. She closed the notebook. She thought about Dolores, who had said the wrong thing for wrong reason and then said the right thing on the record. She thought about professionally. She thought about Petra Holloway in the parking lot, carrying an envelope for 2 months, waiting for someone who looked like they would listen. She thought about Obi, who had handed her the chest tube tray without being asked, because he had been watching and had correctly assessed the situation. She thought about Dr. Ferris, who had taken her clinical input and acted on it because he was still enough to understand that correct information did not carry a seniority requirement. People were complicated. Institutions were complicated. The space between what a system was supposed to do and what it actually did was always occupied by people making individual decisions under individual pressures. And some of those decisions accumulated into negligence, and some accumulated into coverage, and some accumulated into a nurse with a notebook who kept showing up and writing things down. She had not been a perfect employee. She had been inflexible in some situations where flexibility might have served her better. She had sometimes chosen accuracy over tact, in moments when tact would have cost nothing. She had kept her history hidden in a way that had made it harder for the people around her to understand what they were working with. And while she stood by the reasoning behind that choice, she could see its costs clearly enough. She had not saved Orana Vasic, and that was a weight that did not resolve into anything comfortable regardless of what the committee found, or what the board determined, or what changes the hospital implemented. A person had died in a gap that should not have existed, and the fact that the gap was closed now did not reach backward. The work of accountability was not the same as the work of repair. Some things couldn't be repaired. Couldn't be repaired. You accounted for them anyway, because the accounting was what the person deserved, and because not accounting for them, the gaps to them, was how the gap stayed open. She put the notebook in the kitchen drawer. She would get a new one on Monday. The next 11 months would need their own record. On Monday morning, Mara Delgado arrived at Harrow Peak Medical Center at 6:30. She changed into scrubs, clocked in, and went to the trauma floor. Sorensen's meeting was scheduled for 10:00 a.m., and she would go to that meeting and hear the offer and give it the serious consideration it deserved. Between now and 10:00 a.m., there were patients. There was a man in Bay 2 who had come in overnight with a presentation that the night shift resident had logged as atypical chest pain, but which, when Mara reviewed the vitals in context, looked more consistent with a right heart strain pattern that warranted a different workup. She flagged it to the attending physician on duty, a woman named Dr. Reyes, who was 6 weeks into her rotation at Harrow Peak and who listened to Mara's reasoning with the focused attention of someone who had not yet decided which clinical inputs to filter out. "Walk me through it," Reyes said. Mara walked her through it. Reyes ordered the additional imaging. At 8:15, the imaging confirmed a pulmonary embolism. Treatment was initiated. The man in Bay 2, whose name was Warren Pell, who was 57 years old and had driven himself to the ER at 2:00 a.m. because something felt wrong in a way he couldn't name, would be discharged in 4 days with full function and a follow-up plan and the particular quality of near miss. Gratitude that people carried with them for the rest of their lives. He would not know Mara's name. She would not be the person who spoke to him about the diagnosis or the treatment or the path forward. She would be documented in his chart as the nurse who flagged the atypical presentation, to the attending a line in a record, time-stamped, accurate. It was enough. She documented it and moved to the next bay. The trauma floor hummed with its ordinary noise, monitors, voices, the percussion of equipment and movement. That was the background register of a working emergency department. It was not a beautiful sound. It was functional and demanding and occasionally maddening, and it was the sound of a place that was trying to do its job, which was all any institution could honestly aspire to be. Mara Delgado moved through it the way she had always moved through it, quietly, precisely, with the accumulated knowledge of a person who had been in harder rooms than this and had learned in those rooms the single lesson that every subsequent room had confirmed: you could not control whether people recognized what you were. You could only control what you actually were every day in the specific and unsexy work of showing up and paying attention and writing it down. The rest would follow or it wouldn't. In her experience, if you were patient and accurate and stubborn in the right way about the right things, it usually did. She picked up the next chart and got back to work.